Good afternoon, everyone. I am Alex Tercy with the UVM Health Network. Thank you for joining us for today's Facebook Live. Earlier today, the CDC and the FDA recommended a pause in the administration of the Johnson & Johnson single-dose vaccine after 6 cases of blood clots were identified. Both Vermont and New York are following this recommendation, which is to pause. And this was made to allow for a review of data regarding what is an extremely rare side effect. Here with us today to talk about this, to answer my questions and yours, are Dr. Beth Kirkpatrick and Dr. Mary Cushman from the UVM Health Network. So they're going to help us put all this into perspective and answer some questions. Thank you both so much for joining us this afternoon.
Well, it's great to be here.
Yeah. So first things first, this is concerning news to hear. How worried should people who have received the J&J vaccine be?
Do you want me to start?
Sure, jump on in.
Well, I don't think, I would recommend that people are alert and aware, but I don't think people should be personally worried. I mean, it's so rare. As Dr. Cushman said earlier today, like, we don't expect to see any of this in the state of Vermont. And we've only given about 40,000 doses of Johnson & Johnson. It's a 1 in a million chance. So I would say be aware, but I don't know that I would lose sleep over this. I also would say, don't forget that if you just got the vaccine, you will still get the usual vaccine symptoms, and those are not at all related to this. So you may not really love having fatigue or arm pain or a little fever, and people do feel pretty beat up for a day or two after this vaccine, and that is expected, and it's a pain in the neck and not fun, but it's not at all worrisome related to this side effect.
Mm-hmm. Dr. Cushman, anything to add to that?
It's true and very easy for us to say, don't worry.
Mm-hmm.
But people will worry,
sure,
because it's human nature to worry.
Mm-hmm.
But when you put it in perspective, we're talking about what we think is 1 case in every 1 million people that get vaccinated. There's not even 1 million people who live in Vermont. So, you know, it's just very unlikely that we will see a case here, but I can tell you we will be prepared if we do see a case, because we know what to do if we see it. So, you know, I think it doesn't allay anxiety maybe too much for me to say that as a healthcare provider, because it's easy for me to say, don't worry. But I think people want to be educated. That's
sure. Yeah. Yeah, and I think putting those numbers in context, like you said, 1 in a million cases, that kind of helps you put it in context. But of course, there is still concern. I'm wondering, do we know if the vaccine was a cause of the clots in these rare cases that happened?
Well, cause is a pretty strong word. I mean, what we're saying right now is that they seem to be associated, like the people that have these clots, these very rare clots. And there's some particular things about these, as Dr. Cushman will tell you, blood clots are very common in general population. These are not regular old blood clots. And so everyone who's had these strange clots has had the Johnson & Johnson vaccine. The question is, what has predisposed folks to have this happening? And these are very rare circumstances. They do happen out there very strangely, very infrequently, but they do seem to be associated with this vaccine. We just don't know why some people are having them happen and others don't. And I don't know, Mary, do you want to speak to that? Because I think these are not your usual blood clot, I guess I would say.
Right. So the phenomenon that's being observed, it looks like something we call HIT, heparin-induced thrombocytopenia, which is an uncommon complication of heparin treatment, which we see in hospitalized patients. Heparin is a blood thinner we commonly use in the hospital. And this syndrome looks like HIT. It's not HIT exactly. And we know because we have really people around the world who pay attention to what their patients present with them. We know that there have been other cases of what used to be called spontaneous HIT that either occurred with no explanation or maybe after surgery or something like that. And these were the kinds of occurrences that were so rare, we would just see them in case reports. Somebody would observe this interesting case and write a research article about it and publish it. And so we've seen this kind of thing before. I have never seen it in my career here in Vermont. And we see pretty much every patient who has any kind of clots at UVM and in our region who get referred to us for care to our clinic. So we fortunately had a little preconceived idea about what this might look like. And the first physicians who saw this were in Europe, seeing patients after getting the AstraZeneca vaccine, which is a different vaccine that has a similar structure to it. And so they have already worked out for us what seems to work for the treatment and what might be bad to do for treatment. So we have a lot of knowledge, even though this just was announced today and yesterday we had no idea that the Johnson & Johnson vaccine was doing this. At least now we have good leads to go on in terms of what this actually is, how it presents, and what to do about it when it happens. So I think, we have that advantage in taking care of our patients if we do happen to see it.
Great, thanks for sharing that. If you're just tuning in, we are live with Dr. Mary Cushman and Dr. Beth Kirkpatrick from the UVM Health Network, and we're talking about the pause on the Johnson & Johnson single-dose vaccine put in place by the CDC and the FDA. So I have a few more questions. A bigger question was, when it comes to vaccines and medications overall, and you kind of hinted it a little bit, I think, Dr. Cushman, are clots a risk with vaccines and medications overall?
Well, I'll talk about medications and then have Dr. Kirkpatrick talk about vaccines. Yeah. So probably the most common medication that people will be familiar with that contributes to the risk of abnormal blood clots is oral contraceptive pills and transdermal contraceptives and the vaginal ring contraceptive, as well as postmenopausal estrogen and even testosterone used for treating men with low testosterone. And so all of those agents do raise the risk of clots way more than the Johnson & Johnson vaccine does. So, for example, a woman starting estrogen for treating menopausal symptoms might have a risk of clotting, depending on her other risk factors, as high as 1% each year, with way more than 1 in a million that might last for just a few weeks after getting a vaccine. So it's well known and recognized that certain medications can cause thrombosis. And yet, we don't think much of, the risk associated with taking one of those medications if it's something that we need to be healthier. Yeah.
Dr. Kirkpatrick, do you want to add to the vaccine part of that?
Yeah, in general, clotting is not associated with vaccination as a general rule. So this is quite, atypical for vaccines. And I think one of the things Mary brought up that might raise a question here would be like, how do those two things slam into each other? Like, what about this situation and people on oral contraceptives or estrogen or testosterone? And that's a big thing they're looking at right now, because as was alluded to, there's commonalities between this vaccine and the AstraZeneca vaccine. And the reports on the AstraZeneca vaccine, clearly several of those women were on oral contraceptives, vaginal rings, hormone replacement. And so how do those two things slam into each other? And that's going to be a really big thing that the CDC and this American Committee on Immunization Practices, those are the people reviewing all the data tomorrow. They're going to be really looking closely at that.
Thank you for that. As people get their vaccines for COVID-19, what symptoms should they be aware of but not worried about?
Yeah, so I guess the first thing to say is this phenomenon with this rare clotting disorder has not been seen in either of the mRNA vaccine, the Moderna or the Pfizer. So this is really specific to this J&J vaccine. So the symptoms that we see all the time from the J&J vaccine are actually not that dissimilar from the Moderna and the Pfizer vaccines. And those are basically flu-like symptoms. So I think this is a single dose vaccine. Usually the day after or the second day, people sort of just feel like they want to lie on the couch. They feel fatigued, low-grade fever. Their arm feels like they got punched. They might have mild headache, but not at all like you might see on what we're talking about here. So those symptoms go away in a day, 2 days, 3 days, almost always gone by, 3-4 days. And those are seen in almost everyone. And so I think just recognizing if you got the vaccine a couple of days ago, those we do expect those and not to be worried, because the rare event, these symptoms won't come up until the average of about 9 days after the vaccine. So somewhere between 5-6 days and probably 15-16 days are the rare event symptoms. So the ones right after vaccine, they're not really a cause. Then they don't lead into this other thing. They're not they're not gateway symptoms, so to speak. These are not things that sort of turn into something else. They're really two different sets. Okay. Does that help?
Yeah, it does. What symptoms should people then be concerned about in that case?
Yeah, so I'll start, and Mary, please jump in. So the symptoms for this clotting disorder are substantial and significant and severe. And the number one thing would be really severe headache. Worse with time, often worse with lying down, because there's an impact of the CSF, the fluid around the brain on this too. So sometimes with throwing up. So the real severe headaches are a tip off. Atypical for a person, I would say, and severe. That's the number one thing. And then any neurologic event, and those neurologic events could be anything that you might think related to a stroke, from blurred vision to trouble with your arms and legs, severe abdominal pain, easy bruising, and then tiny red dots on the skin. Those are the big ones. And I'm going to turn this right over to Dr. Cushman because she's an expert in this.
All right.
Yeah, so it's important I want to take an opportunity to plug for some education about thrombosis.
Yeah.
So what we're talking about is venous thrombosis, clots in the veins. Thrombosis means the formation of abnormal clots inside the blood vessel. And what Dr. Kirkpatrick was just referring to with the headaches and neurological symptoms, that is the primary type of clot that has been seen in this situation with either the AstraZeneca vaccine or J&J. It's called cerebral vein thrombosis. So you have, arteries bring blood to the body, oxygen and nutrients, and then the veins return that blood back to the heart. And your brain has veins, we call them sinuses, around it. And they're kind of flat little tubes. And the blood comes down. And if there's an abnormal clot in one of those veins, then it causes pressure buildup in the brain. And that's what leads to the headache and can lead ultimately to a stroke, a certain kind of stroke. And so watching for headache that will not go away. And the most common symptom is vomiting with the headache. So that's cerebral vein thrombosis. It only occurs normally in about 1 in every 100,000 people each year. We see a steady trickle in our thrombosis clinic of patients with this. So we're used to seeing that, and we know how to deal with it in collaboration with our stroke team colleagues in the neurology service. Now, she also described this abdominal pain and vomiting, and that can occur when you have thrombosis or abnormal blood clots in the veins that drain your intestines, for example, abdominal vein thrombosis. And so you can imagine if blood can't drain out from the intestine through the vein, you get pressure buildup and the bowel doesn't function correctly. So you get pain and you can have vomiting. These are unusual clots. We see them regularly in our specialty practice, but they're unusual. The run-of-the-mill clots, deep vein thrombosis of the legs, are about as common as stroke, maybe just a little less common than stroke. These are not really what is being observed in this situation with the vaccine. But this occurs in about 1 in every 1,000 people each year. So magnitude's more common than cerebral vein thrombosis. And clots in the leg veins or deep vein thrombosis causes swelling and pain in the legs, in one or the other leg. Sometimes both, but usually just one. And when you have that, little pieces can break off and they travel with the flow of blood. The veins are bringing blood back to the heart. The heart then pumps that blood into the lungs to put oxygen back. And so little pieces of clot can break free and travel ultimately up to the lungs. And that's a pulmonary embolism, which is the more dangerous version compared to deep vein thrombosis. And sometimes would be seen in this situation with the vaccine-induced thrombosis, but not as commonly as the other types.
Great. Thank you for that crash course.
It's always good to have the opportunity. This is a disease that surprisingly the awareness is really poor in the population. You know, less than half of people even know what this is. And it's about as common as stroke, a little less common.
Yes, the information is well appreciated by me watching and talking to you, and I am sure by the rest of our community. So thank you. We only have about a minute left. So I'm wondering if there is anything we haven't covered that you think our community should know about this news, or any final message you have for the community before we sign off.
I'll say, you know, the pandemic is still out there. There's still a much, much higher risk of getting COVID and getting sick with COVID and having clots from COVID itself than from any of these vaccines. So we need to understand what's going on. We need to clearly modify as necessary, but we still need to get the population vaccinated. And so that remains really important. And I think the FDA and the CDC are doing the right thing. It's very conservative. It's very careful. They're really trying to be transparent. And so I think people should, you know, reach out and get the information you need, because I think the attempt is to be as clear and transparent as possible and not discourage people from getting coronavirus vaccines, because we really do need them still.
Yeah, so, I totally agree. And, you know, the risk of thrombosis from COVID-19 is definitely high. You know, up to 20% of hospitalized patients with this infection get a blood clot. So you're much better off getting the vaccine and having the minute risk if you get the J&J vaccine, if that's really caused. Much lower risk to go ahead and do that than to get infected. And please, please wear a mask and keep distant from people as best you can. But we can't forget those basic things, even after you get your vaccine. It's important.
Very important. Well, thank you both so much for taking the time to answer these questions. Thank you, our community on Facebook, for tuning in and watching. We see your reactions and some of your comments, so thank you. We appreciate the feedback. If you do have a question, feel free to post it after the fact. We'll make sure that Dr. Cushman and Dr. Kirkpatrick get it, and we'll answer it for you. So please share this with your community on Facebook and beyond. And any questions, again, we're happy to answer them. I'm Alex Tersey with the UVM Health Network. Thanks for joining us. If you do have any questions or a need for resources, we direct you to uvmhealth.org/coronavirus, where you'll find a lot of great information about vaccines and many other aspects of COVID-19. So thank you and be well.